Welcome to our Mock Interview Pro series, where today we're focusing on helping you ace that interview for a patient care technician role. This profession is all about teamwork, communication, and patient-centered care. Let's dive right in with our first question, which explores the importance of working effectively in a healthcare team. Could you tell us about a time when you collaborated with a healthcare team to provide excellent patient care? This question looks at your ability to work well within a team setting, which is critical in healthcare environments. Here are some tips to help you craft your answer. Focus on a specific situation that showcases teamwork. Clearly define your role and the tasks you handled. Discuss the outcome and how it benefited the patient. Highlight how you communicated and collaborated with your teammates. Reflect on what you learned from the experience. Now, let's look at an example answer to bring these tips to life.
During my training at the hospital, I was part of a team that included nurses and doctors. We worked together to care for a patient recovering from surgery. My responsibilities involved taking vital signs and preparing equipment. Regular communication ensured that the patient was comfortable, which contributed to a smoother recovery. This experience taught me the value of effective teamwork in patient care.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for patient care technician. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you share an instance when you had a disagreement with a coworker and how you handled it? This question evaluates your conflict resolution skills and your ability to maintain professionalism in challenging situations. Let's consider some strategies for addressing this question. Keep your focus on a specific incident. Describe the disagreement objectively. Outline the steps you took to resolve the issue without escalating it. Talk about what you learned from the experience. Emphasize the positive resolution or outcome. Here's an example answer to illustrate these points.
In my previous role, a coworker and I disagreed on the best approach to assist a patient. We decided to discuss our ideas openly with our supervisor, ultimately combining our strategies. This improved the quality of patient care and taught me the importance of collaboration and open communication.
Describe a time when you went above and beyond to ensure a patient's comfort. This question aims to assess your dedication to patient care and your willingness to take extra steps for patient well-being. Here are some ideas on how you can structure your response. Recall a specific situation with a patient in need. Highlight the actions you took to address their comfort. Mention any obstacles you faced and how you overcame them. Emphasize the positive outcome for the patient. Use a compassionate tone to reflect your dedication. Let's go through an example to give you a clearer picture.
There was a time when my patient was anxious before a procedure. I spent extra time explaining the process and answering their questions. I provided a warm blanket and played their favorite music during the procedure, which helped them relax. The patient expressed gratitude afterward, showing the impact of my efforts.
How would you handle a situation where a patient refuses to take their medication? This question tests your ability to handle resistance and encourage patients to follow medical advice. Consider these steps when formulating your answer. Stay calm and listen to the patient's concerns. Ask open-ended questions to understand their reasons for refusal. Provide clear information about the benefits of the medication. Involve the patient in the decision-making process. Document the interaction and inform the supervising nurse or physician. Here's how you might effectively respond to this scenario.
I would first listen to the patient to understand their concerns about the medication. After hearing them out, I'd explain the benefits and encourage them to discuss any issues. This approach helps patients feel involved in their care while respecting their choices.
Imagine you have multiple patients needing assistance at the same time. How would you prioritize their needs? This question examines your ability to prioritize tasks effectively in a high-pressure environment. Here's how you can approach answering this question. Quickly assess each patient's condition to determine urgency. Use the ABCs: airway, breathing, circulation, to prioritize life-threatening needs first. Communicate with patients to gauge their immediate concerns. Enlist help from colleagues if available to manage multiple needs. Document priorities to ensure timely follow-up after initial assistance. Let's take a look at an example response.
I would start by assessing each patient's vital signs to identify any critical needs. If someone is in distress, I'd attend to them first, using the ABCs of emergency care. Then I'd check on other patients, prioritizing based on urgency, and ensure follow-up care is provided.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.